Hello, my name is Elisa, and this is my channel and On the Mind Goes, where I discuss the different things I come across as I'm working towards an AuDHD diagnosis. So, one of those things that I found interesting was having to do with abdominal pain or abdominal issues. Especially, I see a correlation in my research in like females and having abdominal issues. Um, so that I just find interesting because I get these stomach pains that I've gotten ever since I was little. And and they come on out of nowhere. Nothing kind of triggers them or starts them. They just come on and they can have me kind of incapacitated for I don't know, like 30 minutes or so, sometimes more, sometimes less. And really nothing helps it. The only thing that I can do is just kind of twist and turn and try to find like the best position where maybe it won't hurt as much. But a lot of times that is just me kind of rolling around on my bed, scrunching my legs up, straightening them, turning one side, like trying everything I can. I'll find like a position that works for a second and relieves a little bit of pain, and then it stops working. Or sometimes I have to push on my stomach, or other times that doesn't matter. And I can't touch my stomach. I can't have any movement whatsoever. So I just have to kind of like freeze. And that goes with like, I can't have anyone touch me. I can't have like today. So it happened today. And they don't happen that often. It kind of is far and few between. But like I said, there's nothing that really triggers it and it can just come out of the blue. And so I can't really plan for it. And I remember first getting these in elementary school when one of them that I remember, we had gone to my mom's, one of her work friends, their house for like a barbecue or something. And I remember we arrived there and we were in the car and we were about to get out. And all of a sudden, my stomach just started killing me. Like it was cramping so bad. And we didn't really know what it was. I couldn't move. I had to just kind of like, again, find a position and try and stay there. And in my head, I don't know if this is true, but in my head and my memory was I see like my whole family like getting out of the car and going to the barbecue and me just kind of like needing to like just let it kind of ride its way, like pass, and then I would be okay. I also remember getting picked up from elementary school a few times because I had abdominal pains and would go to the nurse. And I feel like we probably went to the doctor when I was younger to get it checked out, I would assume. I mean, I didn't, my mom was a good mom. Um, but I don't know if it was just unexplained or because I was too young, obviously, to be having like, menstrual cramps or something like that. Um, so sorry, I burnt my finger earlier when I was using my glue gun to fix something, and so now I keep like looking down and it's distracting me. Um, but so yeah, so these abdominal pains, I remember even like I have memories of waking up in the middle of the night and going and knocking on my mom's door and telling her my stomach hurt so bad. And we would just have to go. I remember like either kind of laying by her or laying on her lap on the couch and just kind of having to work through the pain and just like squirm around and until it passes. Um, and I remember doing this like a few times. I remember it happened in high school once. I remember like I can visualize seeing us like sitting on the couch, or my mom laying on the couch. Nope, me laying on the couch, my mom sitting on the couch. And me just being in a lot of pain and kind of having to let it work its way out. And again, I don't know like what the doctors ever said about it or if it was just like a mystery pain or something, because I feel like whenever we went, like there wasn't anything that kind of they could link it to. So, anyways, and then I remember when I joined the military, I had one of the flare-ups, like one of my pains come on, and it was so bad. This one lasted like um, I wasn't walking right for a few days afterwards because my stomach just hurt so bad. And at that time, they ended up finding that I was slightly anemic and that they thought that there was like an ovarian cyst that had ruptured. And so I don't know if that's kind of what it had been each time or every time this pain happens that it's like an ovarian cyst that ruptures, or if that was just a one-time thing, or if who knows. Um, I know later I did have surgery and they found endometriosis. So I don't know if part of that also causes it, but again, that shouldn't, from what I'm reading, wouldn't have really necessarily affected, although some things say it could, when you're younger. Um, so yeah, so I don't know, but that's something that I just found interesting was again because I it just happened today where so what it feels like is it feels like first of all it feels like all of a sudden your whole stomach just like blows out. And it's one of those where it gets so painful that you can't, you know how like if you're feeling a little bloated, you can kind of suck it in a little, but in that moment, like you can't suck in anything. You can't do anything. You just have, it almost feels like it's going to continue to expand and then it's going to burst. Like it hurts so bad. And it's always in my lower left quadrant. I used to say kind of what it reminded me of was someone taking like a rod with all these spikes off of it and putting it in my stomach and just twisting it and taking like my intestines as they wrap around it. And like that's kind of what it felt like that everything just kind of like twists and tightens and like hurts so bad. And again, there's nothing I can do about it except just sort of like write it out. I usually afterwards, like I said, I just have to lay there and let it do its thing. And so usually afterwards, I'm pretty exhausted. I think because I've been one extremely tense most of the time of the whole episode. And then also I think just kind of that whole heightened, you're on edge because you were just in a lot of pain. Um, so yeah, so I was just curious if this is something that other people also struggle with or have struggled with, or if you have abdominal pains that are unexplained, or maybe you relate to my story. So I'd just be curious to hear and see how this abdominal pain thing kind of links between autism or AuDHD and others. All right. Well, again, thank you for joining me. And my name is Elisa, and I will see you next time. Thanks. Bye.